Hello.
Hello,
I'm Dr. Preeti. I'm one of the registrars in the clinic today. And you are?
I am Angelina Smith,
Okay. And how old are you?
28 years old.
Here because you want to know the report.
Yes,
So before we proceed with the report, can I ask you a few questions so that I can help you with the report more?
yes.
Yeah. So Angelina, can you please tell me what problems you are facing?
I don't have periods from last 6 months, and I want to plan baby.
Yes. And otherwise, apart from that, any dryness down below?
Yes.
Okay. Okay. And this is the first time you have not had periods?
No.
You always
Already.
have irregular periods?
Irregular periods.
Okay. Okay. And do you have heavy bleeding or scanty bleeding?
Yes.
Okay.
I
So
have always hot flashes.
hot flashes you have. Okay. And do you have pain while you have your periods?
Yes.
Any problem with the waterworks or bowel habits? So do you have any weight gain problem or any acne problem recently?
Only weight gain problem.
Weight gain. Any hair thing coming out from the breast, like water or milk discharge?
No.
Have you had any pregnancy before this?
No.
Any history of miscarriage or anything? Like any other medical problems that you have, like diabetes or hypertension that you take medicines for?
No.
Any drug allergy?
No.
Any history of previous surgery?
No.
Okay. Any history of chemotherapy or radiotherapy or any trauma?
No, not at all.
Not at all. Okay. And also, can I ask you about your cervical smear? Have you done your cervical smear?
Yes.
Okay. And that was normal?
Mm,
Yes. Okay. So your cervical smear was normal as well. The history of having sexually transmitted infections previously?
no.
Okay. Angelina, can I please ask you a few more questions about your personal life?
Yes.
Do you drink?
No.
Do you smoke?
No.
Okay. And any recreational drugs? Okay, now thank you for giving me all the information. Can you please tell me about your family, about the support in the family, about your partner?
Yes.
So your partner is supportive, well
Yes.
supportive. Yeah, and what does your partner do?
Businessman.
Okay. And does he have any addiction or any
No.
problems? Coming to the report, I hope that you are waiting for the report. Come alone today?
Yes.
Well, Angelina, I don't have a very good news for you.
Oh.
So I just want to ask you if you are okay to do this further consultation with me.
Yes.
So I'll tell you the report. Actually, your FSH levels that we have done, they have come very high. Okay, so I'll explain you what it is. What happens is, Angelina, this is our brain. It gives signals to all the organs of the body. These are the ovaries down below, and it produces a hormone called as FSH, and that helps the ovaries to produce eggs, right? Which is FSH. But what happens is sometimes these ovaries don't work, and the brain keeps on continuously stimulating. So this FSH levels go high, right? So with you also, this FSH levels are very high, and this actually means that your ovaries have stopped working. I'm really sorry to give you this news, Angelina. Angelina, I'm really sorry. Tissue, please. So, are you okay? Can we go ahead? Or do you want me to stop here and then we can start?
That means I cannot having baby.
Well, there are many different options to go for that. But yes, if the ovaries are not working, then there is very less chance, because only 5 to 10% of patients who have this problem may have their own children in their whole life. of time, but it is not very sure. So, well, there are many different options to have babies. One of them is having ovum donation or going for adoption or surrogacy. And I'll also give you, I'll refer you to the fertility specialist who can also help you with how to go about having babies. Okay? Will that be okay with you? So there are many reasons why this happens. This may happen because of many reasons, like there can be some genetic conditions like fragile X syndrome. Also, there are many other hormonal problems like diabetes, which may even cause these problems. Okay? There are other autoimmune disorders also, which might have caused this. Apart from all the causes that I have told you, most of the patients have unexplained cause, which is around 60% of the women. But this is not a sure report. We always do a report after 4 weeks to confirm it. Okay, so there will be another report that will be done with you after 4 weeks, and FSH will be checked again. And if again that comes high, then it becomes very sure that you have this problem of early ovarian aging. So are you with me?
Yes.
So can I tell you about the investigations that are to be done? So there are many different investigations like autoantibodies, the thyroid autoantibodies that can be done, the adrenal autoantibodies, karyotype we'll have to check to find out why it must have happened. Okay? But and there are many different treatments that I can give you. Okay? So for your dryness down below, I'll give you the estrogen cream, which will help you with the dryness. For hot flushes, there is something called as hormonal replacement therapy that we can give, and that will take care of the hot flushes. We can focus more on the lifestyle measures like diet and exercise. There are counselors to help you with the diet also, so I can put you in touch with them. Okay, and if you have any other problems, you can always come back. Okay, so I'll give you the referral to the fertility specialist, and I will also put you in touch with the psychological support so that they help these women who are going through the same problem. There are these support groups called as the DAISY Network, Fertility Europe groups. They also help women who are going through the same problem. Okay. I'll also give you the patient information leaflet so that you know more about the condition that you are having. Is there any other thing that you want to ask?